In the spirit of President's Day, we are having a mini-series this weekend called Presidential Pathology, and our first autopsy we're going to talk about is President Eisenhower. Now, to understand the clinical significance of Eisenhower's autopsy, you have to know a little bit about his medical history, and then it'll all make sense. Eisenhower was not a healthy man, okay? So he was president from 1952 to 1960, and during that time, he had a massive heart attack. That was 1955. And it actually destroyed part of the left ventricular wall, which then formed a left ventricular aneurysm, which is a very dangerous condition. It's a wonder that he even survived that. Because of the aneurysm of the left ventricle, he then developed a stroke. All of these things happened during his time in office, but he managed to get all the way through to the end. But he had heart attacks throughout the 1960s, and also he had episodic hypertension. So in 1969, at the age of 79, he started to develop heart failure, and he died March the 28th of 1969, and subsequently had an autopsy. The primary finding in his autopsy was that he had a tumor called a pheochromocytoma. This is a mostly benign, I say mostly because about 10% of them can be malignant, tumor of the adrenal gland, which secretes adrenaline, epinephrine, and norepinephrine. And as a consequence of that, the patient often has hypertension, they can have heart attacks, they can have strokes, they can suffer anxiety. And when they went back through his medical history, it was well documented that he would have spikes of blood pressure that would then come back down. And that's pretty characteristic of a pheochromocytoma. So what might that look like? Since some of my social media sites won't allow me to show tumors from inside the body, I had to make this model of what an adult adrenal gland looks like in terms of shape and size. This is about 5 or 6 centimeters across. They tend to be pyramidal in shape. Now this marble is exactly 1.5 centimeters, and 1.5 centimeters is the tumor. That is the size of the tumor that Eisenhower had. Now, such a tumor can be corrected surgically, but you have to remember back in the 1950s and the 1960s, the abdominal CT scan was not a test that was even invented yet, so they really didn't know it was there. These tumors are pretty rare, about 1 in 100,000 people. They can be part of genetic syndromes like multiple endocrine neoplasia, or they can occur sporadically. It's kind of amazing to think something so small could cause such trouble, and it reminds me of a scene from a movie.
It is a strange